If you've just been told you have an L4-5 or L5-S1 disc bulge or herniation, and you want to know what to do first for a herniated disc, here's your answer. Many people either stay in bed too long or jump straight into stretches and exercises that can actually make their symptoms worse. The good news is that there are 3 simple steps you should follow first to calm the irritated nerve, protect the injured disc, and start moving toward recovery. They are number 1, positional decompression, 2, eliminating pain triggers, and 3, gentle mobility. I'll walk you through each one, starting with the step that can often provide the quickest relief. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. Here's one key thing before we get started. Each step builds on the one before it. If you miss a step, the ones that follow are much less likely to help. That's why I'm going to walk you through them in the exact order I recommend to my patients, starting with the first thing to do right now: positional decompression. When a disc bulges or herniates, the injured tissue and the nearby nerve can become irritated. The goal right now is to temporarily unload the lower back and find a position that helps settle those irritated tissues. One of my favorite ways to do this is using a sturdy kitchen countertop. Place both hands flat on the edges of the countertop and step your feet back slightly. You can keep your elbows straight or rest onto your forearms against the countertop. Then slowly bend your knees and let your hips sink back and down. Let your arms support most of your body weight so your lower back can relax. Stay in this position for 30 to 60 seconds while taking slow, deep breaths. As you do, pay attention to your symptoms. If your leg pain begins to ease or move closer to your lower back, that's often a good sign that this position is helping. You can repeat this several times throughout the day, especially after activities that tend to aggravate your symptoms. Go ahead and try it now. If it helps take some of the pressure off your lower back or eases your leg pain, drop a comment below and let me know. Now that you've helped calm the irritated tissues, the next step is to stop doing the everyday movements that keep aggravating your L4-5 or L5-S1 disc. Think about it this way: if you keep picking at a cut on your hand, it never gets a chance to heal. A disc herniation is no different. Every time you repeat a movement that stresses the injured disc, you keep irritating the tissues that are trying to recover. There are 4 common pain triggers I want to avoid. First, avoid sitting with a rounded lower back. When you slouch on the couch, in the car, or at your desk, your lower spine falls into flexion. That increases pressure on the front of the lumbar discs, which can push the bulging portion of the disc further backward towards that irritated nerve root. Instead, sit on a firm chair and place a small rolled up towel at your belt line. This helps restore the natural curve in your lower back, distributes pressure more evenly across the disc, and reduces stress on the injured area. Second, avoid bending forward from your waist. Whether you're brushing your teeth, tying your shoes, or picking something up off the floor, bending through your spine places a tremendous amount of force on the injured disc. Research has shown that forward bending under load can more than double the pressure inside the lumbar disc compared with standing, making it much easier to continue irritating that L4-5 or L5-S1 herniation. Instead, push your hips backward, bend your knees, and keep your back in a neutral position. This hip hinge shifts the load into your hips and legs instead of concentrating it through the injured disc. Third, avoid twisting while you're bent forward. This commonly happens when reaching into the backseat of your car or twisting to unload the groceries. The outer fibers of the disc are less tolerant of twisting, especially when combined with forward bending. That combination places additional stress on the healing tissues and can keep the tear irritated. Instead of twisting through your waist, pivot your feet and turn your whole body together. This reduces rotational stress on the injured disc. Fourth, be careful how you get out of bed. After a night's sleep, your spinal discs naturally absorb fluid and become slightly more hydrated. That also means they can be more sensitive to bending first thing in the morning. Sitting straight up places an immediate flexion load on an already irritated lumbar disc. Instead, roll onto your side first, let your legs drop off the edge of the bed, and then use your arms to push yourself up. This log roll technique keeps your spine in a safer position while reducing unnecessary stress on the injured disc. These may seem like small changes. Put together, they remove hundreds of unnecessary stresses from your lower back throughout the day, giving your disc a much better opportunity to settle down and heal. Once you calm the irritated tissues and stop the movements that keep aggravating your disc, it's time for the final step: gentle directional mobility. The goal here is not to stretch your back in every direction. The goal is to restore movement in a direction that your lumbar disc can tolerate while encouraging your symptoms to gradually settle down. There are 3 exercises I commonly start with. First, standing back extensions. Stand with your feet shoulder width apart and place both hands on your lower back. Keep your knees straight and slowly lean backward, then return to standing. Repeat this 10 times, holding the backward position for 1 to 2 seconds. For many people with a lumbar disc herniation, extension movements help reduce the repeated forward bending forces that often contributed to their injury. They may also encourage the disc material to move away from the irritated nerve, helping reduce leg symptoms. Second are prone press-ups, also known as McKenzie press-ups. Lie on your stomach and place your hands beneath your shoulders. Slowly press your upper body upward while keeping your hips relaxed on the floor. If a full press-up is uncomfortable, begin by supporting yourself on your forearms instead. Like standing extensions, this movement gently loads the spine into extension and for many people helps reduce pressure on the irritated tissues while restoring comfortable movement. Perform 10 repetitions holding the top position for 1 to 2 seconds. Third, lateral hip glides. If your pain travels down one leg and you notice your body leaning to one side, a lateral hip glide may help. Stand with the shoulder opposite of your painful leg against a wall. Keeping your feet together, gently shift your pelvis towards the wall and then return to the starting position. Some lumbar disc herniations create a protective sideways shift in posture. This exercise can help gradually restore a more neutral position while reducing irritation around the affected nerve. The most important thing to watch for with all three exercises is how your symptoms respond. If your pain becomes less intense or starts moving out of your leg and closer to the lower back, that's often a reassuring sign you're moving in the right direction. Now, if your leg pain becomes significantly worse or travels further down your leg, stop the exercise and seek guidance from your healthcare provider. I have other videos on my channel that demonstrate each of these exercises step by step, including the most common mistakes to avoid and how to know if you're helping your specific disc herniation. I'll link these videos below in the description section. In this video, we covered the 3 most important first steps to take after an L4-5, L5-S1 disc herniation. We started with positional decompression to help calm the irritated tissues. Then we identified the 4 most common pain triggers to avoid. And finally, we went over 3 gentle mobility exercises to help you start moving safely again. If you followed along with this video, which strategy helped you the most? Was it positional decompression or standing back extensions? Drop a comment below and let me know. And if you found value in this video, please give it a like and share it with someone dealing with a lumbar disc herniation. Doing that helps more people find practical, non-surgical solutions that may help them move better and feel better. And if you're new to the channel, make sure you subscribe because I upload videos like this every week that help you better understand your condition, make sense of your symptoms, and make more informed decisions about your recovery. Now, if you'd like to learn exactly how to perform these gentle mobility exercises safely at home, go watch this video next. I'll show you the complete step-by-step routine and explain how we help patients reduce pain, restore movement, and get back to doing the things they enjoy.